Well, okay, so the foundation,
So I don't know.
so the foundation, yeah, it's for working taxpayers.
Arthur, we're ready. If you're still there, Mr. Shore.
Do we need a quorum for a foundation meeting?
You should, that's.
Absolutely.
And we do.
Except for approving the
That was a problem before.
Can we, whoever speaks, can we speak a little bit louder? Because, some of the audience can't hear. She expressed concern that you couldn't really hear. Back there, it sounded kind of muffled. And she said that she thought we needed a mic. They can hear. I'm just letting you guys know that work today if we need it. Okay, we're ready. Oh, no, we're not.
What are you doing? Dr. Logden standing around the fountain?
This one, that's it. Come
Got a call.
on. They texted me and asked me, can you bring me some lemon and sweet bread? Like when? I'm like, when?
You weren't, no, not specific. This is sweet, so you can have a cookie.
Because you don't even eat.
Dr. Logston?
You gotta call her. You want to call him, Madam President? Is that
Got a roll
what
call.
he probably doesn't know that we're waiting on him because he makes a quorum.
Do we have a quorum?
Not
Not
yet.
yet.
Director Loxton got a phone call.
Oh, I should. But we have a quorum.
No, we
got
don't. There's only 5 of us anyway. Even if you.
You gotta have 4 in the room.
In the room.
There has
Thank
to be
you.
4 in the room.
Quorum in the
Are you gonna go
room.
come?
Thank
You're
you.
gonna try.
Wait, there's 5 of us. 4 of us.
But we have to count the people physically here.
The room, yeah, okay.
We'll be starting soon.
Good.
They need a quorum. Meeting started.
Okay, call the meeting to order at 56 PM.
Director Perezville,
Here.
Director Shore,
Here,
Director Delara,
Here.
Director Logston.
Yep.
Secretary Baraza.
Here.
Vice President Rodriguez, he is not with us, and President Rogers.
Here. We have approval of the agenda.
So moved.
Second.
All in favor, please say aye.
Aye.
Aye. Opposed, motion carried. Public comment. At this time, comments in the audience may be made on items not listed on the agenda that are public interest and within the subject matter jurisdiction of the district. The board has a policy limiting speakers to no more than 3 minutes. The board cannot take action on items not listed on the agenda. Public input may be offered on agenda items when they come up for discussion and or action. Consent agenda.
There are no public comments.
I move approval of the consent agenda.
I second.
Okay, Director Perezville,
Yes.
Director Shore,
here,
Director Delara,
Yes.
Director Logston.
Yes.
Secretary Baraza. President Rogers.
Yes. Reports. Number 1. Staff report improving access to healthcare.
So in the packet is a staff report and updated report from Borrego Health on Desert Highland Gateway. If there's any comments about that, if not, we would like to highlight a little bit on item A, City of Palm Springs Youth Project, if you would. Okay, yeah, please.
Okay, it's just to give you an update on improving access to healthcare to Desert Highland Gateway through the 3.5-year grant that we had with Borrego Health that was then absorbed by DHP Health. That grant ended 30th, 2025. We have that, and we being Alejandro and I have met with representatives of the Desert Highland Gateway community, in particular Dieter Crawford, about continuing service up there. What do we think the community needs, or they're going to ask the community what they've really, how they thought about this. This for 3.5 years, we had mobile health as well as dental that they really didn't start up until January. They would like maybe continue the dental maybe once a month, but they would like to see us continue with the mobile medical health through our DPMG. And we would tie it in with the Find Food Bank distribution that is second and fourth Thursday. They get about 300 to 400 families and cars that come through, and we would be able to park. We're getting permission to park the mobile unit across the street at one of the church parking lots. Baylin and Sergio are going to work on also advertising that the walk-in if they need be. And also that we will be having specialty clinics up there. We'll be bringing the Pink Journey back. We'll be looking at bringing a vision thing, and we'll be working with the DAP to also continue with providing dental services as well. So that kind of segues slightly into the
No, you're
Palm
fine.
Springs
I forgot.
youth project that Alejandro was going to talk about.
Yeah, so the city of Palm Springs, kind of going a little bit back with the Desert Highland Gateway needs assessment that we did. The first one targeted the whole community. The second one that we did was a youth needs assessment. Through that youth needs assessment, there was a couple of things that stood out. One of them being intervention, youth diversion programs that will hopefully, redirect them away from the local gang violence that is happening there in the Desert Highland Gateway community, and also in the San Rafael adjacent community down the street on San Rafael, between gangs, Black gangs and Latino gangs that, every so often we hear in the newspaper of a shooting, a death in the community. So we have been working and meeting with key stakeholders to talk about how we, could assist in that issue. We have, met several times. We have the support of the Palm Springs Unified School District. We're working with, the city itself, the representative for that area, Councilwoman Grace Gardner, Lieutenant Mike Villegas from the Palm Springs Police Department, Dieter Crawford, Pedro Rodriguez, and other staff from the Coachella Valley Housing Coalition, Juana Hall, Beverly and Billy Harris from We Are One United, and Joe Mota from Live to Rise. In the last meeting, we had a young man who grew up in the San Rafael community in one of those trailer parks that we want to target. And now he works with the county housing department, and he grew up, experiencing that gang violence. So did Joe Mota. He said when he was in high school that, fights between Black and brown students were happening pretty much on a daily basis at that community. So what we're trying to do is kind of bring forth, a project that's going to increase youth opportunities for different programming that are going to be spearheaded by community partners. But before we do that, we are working with KDI, who has been working with the city of Palm Springs on their parks master plan project, and already has some connections in those two communities. So we are working on that proposal, and we just kind of wanted to put this information on the board's radar. And here in the next month or two, we'll be bringing forth a proposal to fund that KDI proposal that's going to be doing a needs assessment, community outreach, hosting a couple of community forums in those two targeted communities to kind of bring some of the community members out and hopefully start implementing some of these things that would come from the meetings that we'll have with the community.
Good work. You know, I had a opportunity to listen to a talk from the principal of the Desert Hot Springs High School. And he talked about how they had the similar kind of problems with the fights between the Black community and the brown community. And he said he was very successful in doing extracurricular activities with these gangs, and taking them on nature hikes and you know, integrating the teams playing basketball together and things like that. That was very helpful in terms of getting those communities together. But good work, Alejandro.
Thank you.
Madam President?
Go ahead.
Okay, so, Alejandro, the two communities that are identified, Desert Highland Gateway and San Rafael Drive communities, are those the two communities that are the highest rate throughout the Coachella Valley? Is there, I guess I'm just wondering, when I read that there's a shooting in Coachella and that, you know, I never get any details whether it's gang related or not. But I'm just wondering, is there, should we, instead of thinking of the problem like this, should we look at if there's other communities that also have to have this kind of work, identifying stakeholders and addressing another community instead of just doing this, but being more inclusive? So your thoughts?
Yeah, I think, you know, this could serve as a model, just like we did with the needs assessment that we did in the Desert Highland Gateway community. And then we replicated that same model in the Dream Homes community. So I think if we really work, you know, starting with this project and see if we could create a model of bringing all these stakeholders together, involving the school district, the police department, the cities, you know, to create some of those opportunities for the youth to collaborate, to enjoy time together. One of the things that was mentioned in the meeting is doing hikes with the Friends of the Desert Mountains and taking them up to the tram and having those kind of activities together. But to answer your question, Director Lara, I think this could serve as a model that we could take to other cities throughout the Coachella Valley. I think why we did this is we already had the data from the youth needs assessment that we did, you know, 7 years ago. So it was already identified. So that's why we're working with this particular community.
Thank you.
Any more comments? Any public comments? Moving on to number 2, DPMG Mobile Health Clinic operations.
Nothing outstanding to report at this time. Keep doing the great work.
Doing a great job. And I'm noticing more and more appear on public media about pictures of our clinic and our mobile vans.
Yes, and actually, you know, we actually
into that.
perfect segue into our great director of marketing and communications and marketing, Will Dean, put together, you know, a group of, maybe you could explain it better.
Yeah.
So we are doing a video project on the mobile medical clinics and just got together with a group of professional videographers. Alejandro helped me identify the people that we wanted to speak on the video about this program and how they benefit. We actually recorded at the clinic's visit at the Access Hub for the unhoused community. And actually got a couple of, maybe one of them, on camera talking about how he benefited from the mobile health clinics. So that's going to be shown at a conference in September.
Yes.
And we're going to have a video that lives on our website and social media.
I actually took a picture at one of our hub clinics of our barber with a homeless person that he gave his permission to let me get his picture, and he looked like a wild man before the barber showed up. And then I have a picture of him after, and he, you know, he looks like he's going in for a, you know, $1 million a year job interview. I mean, it's really a transformation right in front of you. I'll share those pictures.
Yeah, so we're looking forward to, that was an ask from the Mobile Healthcare Association to do a 2-minute video to kind of show within, you know, the conference itself and the panel that I'll be speaking. So thank you, Will, for putting that together. And we also, our CEO was there and also did an interview. So it we hope to show it maybe at the next board
Let's
meeting.
show a clip. That'd be fun.
But we'll show it, yes.
Yeah, we'll do that at the next board meeting and that, so in September.
Next, any more comments? Next committee meeting? Finance Committee, for the foundation.
Any updates, any questions on the agenda or items that were discussed at that foundation financial committee meeting?
Any comments? Okay, next program committee for the foundation, Director Lawrence Gill.
The draft meeting minutes and the grant payment schedules are in the packet. If anybody has any questions?
No comments? Any board member comments?
Safe travels, Director Barraza. Thanks.
Enjoy your conference.
Great.
Can't wait.
Chris.
Okay. Adjourn at 7:09.
Good night.